Thank you all for coming this morning. We have with us today Minister Oberle, who is going to be talking and answering questions about the cuts to services for people with disabilities in this province. We're going to give him a couple minutes at the start to introduce himself and the work that he does. Also want to say that when we come to the questions, we recognize that this is a pretty intense and emotional issue for those of us in the community who are affected by these cuts. And we ask that in that context that we try to be respectful in our questions and our discussion this morning. Be honest, be truthful, but please try to speak with respect for everybody in the room. We only have an hour with the minister, so we want to keep questions pretty short and tight and focused, and it'll be one question per person because there's so many people here who have questions that we want to give as many people as possible a chance to be heard. So with that, I'll turn it over to the minister for a couple minutes. Thank you for coming.
Good morning, everyone. It's a real honor to be here this morning. It's wonderful to see so many people out. We have no, sorry. Can you hear me? Okay, it's wonderful to see so many people out this morning. We do have a short time this morning, and I'll apologize for that. I'm on a very busy schedule. But this is part of a conversation, and we'll be back. And there will be regional meetings, and I'll be traveling around, and staff will be traveling around. We'll be doing a lot of talking over the next little while. We want to understand individual concerns and opportunities as we go forward. You'll have ample opportunity to talk with us in the next few months. I'm really happy to be here this morning to talk to all of you, and Premier Redford also asked that I extend her greetings to all of you and to welcome you here this morning. The Premier and I and other people we work with in the government believe in a province where people with disabilities can be part of the community. In fact, we believe that people with disabilities have a right to belong to their communities, to contribute to the best of their abilities, to have their contributions valued, to live with dignity and respect. We also believe that those who are able to work and those who want to work should have the help they need in order to do that. Our PDD program is a good program that supports people to work and be part of their community, but we know we can do better than we're doing right now. So we're going to move to what we call an outcomes-based approach. That means we're focusing on getting good results for individuals, for you. The focus of the entire system will be on the individual, because that's what you told us that you wanted. We want to make sure that our services are making a difference in your life and helping you achieve your goals. And that's how we will measure ourselves, by those outcomes, your goals. I know that an important goal for many of you is to find a good job, to belong in your communities and contribute. You want to be able to make your own money, meet new people, learn new things. I can tell you those are things most Albertans want, and I'm trying to make sure that everyone has a chance to do that, that we provide the supports so that people can do that. So we're taking an employment-first approach with PDD. Employment first means that our first goal should always be to help adults with disabilities find good jobs, rewarding jobs. We will be using the Alberta Works programs to help us improve our employment supports to persons with disabilities. Now, I want to make it clear this does not mean that everyone has to get full-time jobs. That's not what we're talking about. We want to help people to work as much as they are able and as much as they want to in order to meet their individual goals. My goal is not to have everyone working 40 hours a week. It is to have people take part in work-related activities so that they can belong in their communities, so they can make the contributions they want to, and they can have those contributions valued as they should be. We want persons with disabilities to be able to share in the independence and pride and social life, that working life, that belonging brings to all of us Albertans. Moving forward, we want to hear from you. What is right for you? What are your goals and aspirations? Because that's what will drive us. Hearing you is a process, not an event. This is not the last time you'll see me. This is not the last time that you will see staff from my department or from the PDD locally or from the regions. We will be back We will monitor how this is turning out, and we will talk with you, and we will listen at all times going forward. There will be follow-up as we move forward. I do know that everybody's different. Each person will continue to get services based on their unique needs, and we will still support people with volunteering and other activities like that. Now, the particular point of concern is that community access funding has been cut. That's very true, but it's not going away. And people that need community access supports will still get it, regardless if it's called community access or not. We have taken some money out of community access. We want to focus our supports on activities that get better outcomes, like employment. We are also going to pay the paid staff and the contract services staff more money going forward, because we feel it's very important to stabilize that workforce. We've got a lot of very dedicated people providing very good services out there. We want to make sure we keep them. We're also...
Maybe interject.
Yeah.
Because we do want to really focus on people's questions. Thank you for that introduction.
Okay.
We had a number of people in the community, self-advocates and allies, who've been having discussions around this, and out of those discussions, we have a selection of questions that have been prepared for this. So I'm going to ask a few of those questions, and then we'll be turning it over to people here. The first of those questions is, what happens if people with disabilities do not have access to natural supports? How are we going to prevent situations like what happened with Betty Ann Gagnon, who died because of abusive support in her home? Well, support isn't the word that can be applied there. So what happens when people do not have natural supports as the external supports are being cut out?
Well, first of all, I will say that going forward, supports are based on the individual's needs and situation, not based on a formula. So obviously some people don't have natural support. With respect to people that suffer abuse or neglect in situations, we all have a duty to report to whoever is available. Under the Protection for Persons in Care Act, we have a duty, an obligation to report. We will act on every incident that we uncover or reported to us. We can all work together to prevent situations like that. But going forward, your supports will be based on your individual situation, not on a formula.
The next question that was brought from the group is, how are all of these changes going to be made in just 3 months, and all of these cuts made by July 1st? Yeah,
so that has been brought forward by a number of partners, service agencies, individuals. That is a concern. I can tell you right now that I absolutely get it. I hear you, I understand you. This is traumatic and it's an aggressive change. The overall vision is one I think we all support. How we get there is another question. I recognize we will not be successful unless we work with people, listen to people, and move forward on that basis. So in the last couple of days, we've been looking at what our timelines are, what our schedule is, and how we achieve that transition. We've been talking internally. I've talked to Minister Hancock. He absolutely understands that we need to be very careful here. So we will get there on a timeline and in a process that works for all of us by talking and continuing to talk to people and listen to people.
So just to clarify, is that the point, that the timeline that has been set, that July 1st deadline, is that being considered, given consideration, given the impacts that it's going to have on the service providers in the community and the people who are depending on those services now?
Yeah, and so first let me underline again that people that depend on services, that need services, will still get those services on or after July 1st. We're looking internally right now. I have nothing to announce today, but we're looking internally at how we get there and how significant that date is. I need to talk to a lot of people and work together before I can answer that question more thoroughly. But I can tell you right now, I absolutely get it. Minister Hancock gets it. Our PDD chairs and CEOs get it. We have a lot of talking to do, and we will work together to achieve a transition.
This next question comes from one of the self-advocates, and I'll use their words. What if I need a place to go during the day, but cuts to my services don't cover both a place to live and a place to be during the day?
addressing that situation?
Yes, and thank you for asking that question, because it allows me yet again to underline that people who need services will still get services. This is not at all a backing away from what I feel is the duty of the Alberta government to support persons with disabilities. We are going to do a transition that allows us to do a better job, focus on outcomes, on individuals' goals and aspirations, but we recognize there is we have to provide services, and if you need services, you will still get them after July 1st or in years going forward.
You've mentioned employment first as a core goal in this redirection. How will that work for someone who does not have a worker to help them get and keep a job?
Yeah. And thank you for that question, because it again allows me to underline that people that need services will get them. We recognize that for some people, employment is only possible with supports, often not just to the employee, but to the employer as well. Again, this is not a cost-cutting exercise. This is, it's not. Well, I'm sorry, but it's really not. And if you look at the budget, actually our budget went up this year. This is about providing supports to allow people to live inclusive, productive, valued lives out there, dignity and respect for persons with disabilities. If you need supports to work, you will get supports to work. That's what it's about. This is not a cost-cutting exercise.
Maybe I'll jump. Do you mind if I jump in?
Yeah.
Sure.
Hi.
Just introduce, this is Brandon Oberle, and you're the
I'm
Assistant
the
Deputy
Assistant Deputy Minister of Disability Services. Thank you. Good morning, everyone. I'm absolutely thrilled to see so many people out here. I have the responsibility for children with disability as well as adults, so the full range, not just PDD, but brain injury, kind of the broader scope. So one of the reasons that you're hearing a lot more about employment at the moment is because as part of the discussions that have happened across the province, people are saying, how can people have more inclusive lives among all? So employment first is really kind of a philosophy to say, let's give people the opportunity to have a long-term career. Not everybody is able to do that. There's lots of different ways of people to participate. Volunteering is important, supported employment, placements. We've heard a lot from employers to say, we need to have a broader workplace. And so how do we make that happen? Next week, we have a forum that is focused on employment and innovation for people with disabilities. And we have people from across the country, and as well as in the States and in Alberta, to look at what models of employment have worked. It's going to be available by webcast, so you can see all the information that are there. The idea is it's not going to be implemented July 1st. The idea is this is going to take some time. This is going to say what is the right model, and it has to be adapted to individual people. So we know we have lots of programs within the Calgary area who do a very excellent model around employment. Those will be some of that we will build on. And we have Dr. Alex Hilliard here, who is the CEO from Calgary, who can certainly describe some of the models that have worked really well. So it's not a one-fits-all, but it is a shift. It is a shift to basically say, how do we plan for a life for a person, not just in work? And how do you have that planning that starts when people are children and youth, and it continues through adulthood? It's not just a job. It's around how do you have a plan for people to be included throughout their life.
How do we know, or rather, how do you know that community access did not get, as you say, good outcomes? We would like to see the evidence of that, because there are many people in this room and in the community who feel it has made a very significant difference in their lives.
Yeah, I'm going to ask Brenda Lee to respond specifically on the evidence, but I will underline again, if you need community access supports, you will still get community access supports. We recognize that's a quality of life issue. We haven't eliminated the community access budget. But I will ask Brenda Lee to comment in more detail.
So we've had a number of quality of life measures throughout the years in PDD. We also have a process right now where we're looking at personal outcomes. We've been looking at the research from across the country around what is models around community inclusion, social engagement. So there's a number of measures. We'd be happy to provide that information.
If the funds that people are getting for their services are based on SIS, what happens to people who have not had an SIS evaluation? And what happens if the SIS was done a while ago and the person's needs have changed?
Okay. Dr. Alex Hilliard would like to comment on that.
Good morning. If the supports intensity scale information, or the information about your supports that you require or need for you to be in the community, if those have changed, then obviously we would want to reassess that through some process. So if you've had a supports intensity interview done in the past, we'll sit down and have a conversation about how relevant is it today. That was the first part of your question. What was the second part?
Well, what about the people who have not had an SIS evaluation?
Okay, I appreciate the fact that we are, at this stage of the game, approximately about 85% of individuals within the province who have gone through the supports interview. Well, we have 2,000 people who've gone through the interviews in the Calgary region in regard to the people that we support. So simply, there is a group of individuals who have not gone through that interview. I understand that. So for the purposes at this point, our staff are meeting with individuals around that to assign some understanding of what that support level would be so we can begin to put together some plans. And then later on, as we go through the assessment, we'll make adjustments accordingly. So we're talking to people to make an initial determination who best know the individual, and that would be the support group around them. And then as the interviews are done, we'll make adjustments as we go forward.
So with this emphasis on employment, the question that's being asked is, what is wrong with people with developmental disabilities doing what everyone else does at 2 p.m., going to Tim Hortons and having a coffee?
So I spoke to that last night. I gave a speech here last night to the ACDS, and I specifically addressed that point. I want to tell you here and now that was insensitive at best of me to cast community supports in that light as if it was just simply going for coffee. And I apologize for that. I sincerely apologize for that, and I could have been more sensitive, and I also could have been more eloquent. What I was trying to say was that there's a difference between community access and community inclusion. There's a difference between accessing a community and belonging to a community, and we want to focus on activities that provide those kinds of outcomes, on inclusiveness, on belonging. So I sincerely apologize, and yes, I go to Tim Hortons myself at 2 o'clock in the afternoon.
So we're going to have some questions from the floor now. I think we were going to start with Lloyd. Lloyd. Ryan's going to come over with the mic. And for folks on this side, we have Denise with the mic.
Hello, my name is Latonia, and good morning to everyone here. It's good to see everyone here today. Support people with disabilities. And my question is to the minister. Well, people with seniors with disability, how are you going to help those people if you cut $45 million out of the government funds? So how are you going to do that?
But if I understood your question for the minister, you're concerned about supports for adults as they age, seniors.
That's fine.
Right, okay. Well, as you know, we did look at the supports for adults as they age with developmental disabilities in the region, and it is a concern, and it's part of, as the minister's identified, looking at how people's supports change over time. And so we'll be adjusting supports based on their needs as they age.
Okay, thank you very much.
And next we have Dawn.
Hello.
Good morning.
Doctor Ellie, I wrote this letter. Dear Faith Obi and Alison Redford, I do not want to lose my support staff. They are part of my life. No. We do not want to cut. I do not want to speaking. She's part of my life now. Cats will hurt us all. Food shopping, she helps me cooking. Mickey takes me to the doctors. I like to get out with my worker in the community. It's not nice what you are doing. What you are doing. From Don't Look.
Thank you, Don, for that obviously very personal and very heartfelt comment. And I will say at this level that if you need supports, you won't lose the supports. This is not about cost cutting or reducing supports to people that need them. You have a letter there, and Dr. Hilliard is going to talk to you in a few minutes. I'd like to see the exact concerns you have. We will respond directly to you as soon as we can see what you've got there. And at any time, we encourage you and we will make the effort to talk to you on a personal level, as we will with any individual in this room. Again, people that need supports won't lose them.
We're going to hear from Kelly next.
Hi, my name is Kelly Tower from Lethbridge, South Region. And the first question, this the map or drawing for the changes?
I'm sorry, is there a detailed map of
Yeah.
changes? Well, so let me tell you this. We have an overall idea, a plan for moving forward. But any plan for change involves individuals. That's you. So I don't have a detailed plan until I talk to every individual, until we work with individuals in how to transition this. You will have every opportunity to work with us, meet with us, and that will help us develop the detailed plan moving forward. And Brenda Lee also wants to comment.
So some of these changes that we're going through right now in PDD, they've been underway for a while, since about the last 4 years. So the implementing of the outcomes-based contract is new this year. But some of the change initiatives and the priority actions for PDD, that's been a while. The introduction of the SIS tool to kind of have a more standardized approach, that's all building on how are we moving the system from a historical approach to one that's based on individuals. So this is part of an overall, the change initiative information around kind of where we're going is all posted on our website, and I'd be happy to provide our website.
Thank you.
So we've been hearing from a number of self-advocates. we're going to hear, and I realize I forgot to introduce myself again. My name is Grant Neufeld. I'm on the board of the Scope Society and also here with the Disability Action Hall today, which is, if you don't know, an absolutely fantastic group of self-advocates and allies in the community who are making real changes in people's lives. So if you have a chance, get connected with the Action Hall because they're fantastic. So we're going to hear from one of, We're going to hear from one of my fellow board members and a parent in the community. Pat, do you want to?
Hi, my name is Pat Lenotte, and I am a parent of a child with complex needs, well, a young man. I'm confused. I don't understand, Minister Oberle, as you've said, no services, no person who requires services will not get services, yet you are cutting $15 million from the Calgary Regional PDD Board. How does that happen?
I will ask Dr. Hilliard to comment on the specific Calgary situation in a moment. Overall, my PDD budget went up by $3.5 million, a modest increase this year. Yes, I cut $42 million out of community access services, but all of that money was reallocated in the department. A very large part of that was consumed by a wage increase, which I think is an absolute critical piece moving forward to stabilize frontline services. The budget envelope that you see in the budget is not our total budget envelope either. The employment services that we're talking about exist on the Alberta work side, which is in Minister Hancock's larger human services budget. We recognize there are pressures. We will work very closely to work through that. It is going to be a challenging year. I don't for a second deny that. We've got a lot of work to do to put that budget on the ground. I'm going to ask Dr. Hilliard to...
But sir, you have, excuse me, this is like you're consulting with us now. The cuts come in July 1st. Is it not like shutting the barn door after the horse has escaped?
I'm going to ask Dr. Hilliard to comment on... I'll ask Dr. Hilliard to comment on the specific local situation with PDD here.
Good question. And no, seriously, it's a good question. And what are we going to do as we deal with the situation that we're all facing in Alberta in relationship to our economic environment? Clearly, we're looking at basing support needs on what people need and require to be in the community, and we're aligning our resources accordingly. And we'll be looking at that over the course of the next 2 months to look at impact assessments and how we transition successfully into that. So it's an alignment of resources in the most appropriate way based on people's needs. And we will be consulting with people as we go through and looking at how we transition. It's not going to happen, not like shut the door July 1. There's obviously going to be transitions because there's been adjustments that will need to be made over time. So we will sort through that over the next couple of months about how we're going to make those transitions.
What do we do in the meantime?
Yeah, exactly.
For all intents and purposes, what we're doing over the course of the next 2 months, we're meeting with many of you. We're beginning to look at the impact assessments of it, and we'll have a better understanding of that before July 1st, and we'll be in a position to put transition plans into place before July 1st. For those who would be impacted or believe that there's concerns to be addressed.
There are other issues in the community that are tied in with this as well. We're going to be hearing from Donna from Mount Royal University to talk about how provincial cuts are affecting there.
Thank you. Good morning. So I'm Donna Dunn. I'm a part-time instructor in the Disability Studies Diploma Program. Along with the cuts to PDD, one of the things that we were hoping to provide was qualified students to add to the workforce, and they have been greatly accepted by the community here. As of April 16th, Mount Royal University cut the Disability Studies Diploma, and it will be canceled after 1 year. So my question to you is, along with the cuts to PDD, there's also been cuts to post-secondary. How are you going to address the workforce shortage as you go forward?
think the first step we need to do to address workforce issues is address the pay gap. And we've moved in very large part to do that this year. So that's a very important step. And going forward, we've got the Workforce Alliance working on how do we build long-term stability and qualifications and all those things in our workforce. Also another very important step. I'll freely admit I'm not actually familiar with a particular program at Mount Royal University. Nobody can cut a university program in Alberta without the permission of the minister, and so far he has issued none. So I will ask the Minister of Advanced Education to look at that specific program. I have already asked them to look at a sign language interpreter program at Lakeland College, and in that instance the program was suspended due to lack of enrollment. They did not cut the program and are unable to cut the program without the Minister's permission. This is new to me. I will bring that up with the Minister tomorrow.
We're going to hear from Thomas Paulson.
Yeah. Please. Hi, my name is Thomas Paulson. I work for an agency here in Calgary that receives PDD funding, and I'm also a Disability Action Hall member and a person living with a disability, so I've been on both sides of the service spectrum. I'd just like to ask the Minister about, my understanding is the projection is that the demands for community access supports is going to increase moving forward, and particularly with the closure of Michener Centre. I've also heard that with these cutbacks in services that the projection is that 1,200 people are going to be laid off or thrown out of work. Well, how does the Minister expect to be able to meet the increased demand with a shortage of qualified and available people to do the work that needs to be done? Oh, and by the way, what good is a raise in pay if you don't have a job to go to?
You know, there's a lot of rumor and conjecture out there. I haven't seen any such numbers. We're confident in our budget moving forward that we're going to be able to work with people and with agencies and deliver the services that are necessary in our province. And if we're not, then we're going to have to figure out how to do that. We will not take services away from people that need them.
We have another question in the back.
Minister, with all due respect, I ask you, have you ever lost your sense of belonging?
Obviously, I can answer that by saying no, I have not lost my sense of belonging, but I can also answer that by saying that nobody is intending to take anybody else's sense of belonging away either. In fact, we intend to help you achieve your goals and your aspirations and belong to a community. That's what these changes are about.
So, from the floor.
Hi there, my name is Lisa. I'm wondering what your government is prepared to do for employers to support and teach them about the benefits of hiring a person with a disability.
That is an excellent question. Very difficult to answer at this stage because there's a lot of work to do. But I can tell you that, I'll give you an example. Washington State, in our disability community, we have an employment rate of about 20%. And in Washington State, it's close to 70%. We completely understand that they didn't get there by accident. They didn't get there by turning people out on the street and telling them to get a job. They got there through legislation, through supporting individuals who need support, and supporting employers who need support. And that's where we need to go. So we will be supporting employers as well. We already have employment workplace supports computer screens and all kinds of technology things that we do. We need to do that more. Actually, the service provider network and many employers are out there in front of us, identifying the supports they need. Programs like We Belong in Edmonton, a number of in Calgary here. We recognize that this is not going to happen by accident. It's going to take action, legislation if required, and supports where required, and we will do that.
Maybe I'll just add to it. So our Alberta Works program, so this is the first year that PDD has been in a new ministry called Human Services. And Human Services is a broad ministry. It has child intervention, it has child care, it has all the employment supports, it has all the disability supports. So that's the unique opportunity, is now looking at all the programs that Human Services provide, particularly the employment program, because there's been a number, probably for about 20 years, looking at what do employers need to have successfully people move into the workforce. So that's the shift, is taking what has already been learned through Alberta Works and applying it to our disabilities to see what can we learn. But certainly employers have asked for a variety of things. They've asked for coaching. They have asked for some people to be there when they first arrive to accommodate any special needs, whether it's visual impairment, hearing impairment, or just kind of understanding the workplace. So they have asked for a variety of things. This is also on the agenda in terms of the federal government, looking at employment for people with disabilities. It's one of their priority actions. So we'll work together. We'll build on what's already been successful, but also in terms of what else needs to be done.
Hi, my name is Tricia Wheatley, and I am mother to a number of PDD recipients, current and future. And as I appreciate that we need to be saving money, we're all in it together, we need to cut costs where it's appropriate. However, I think you're taking money from a larger group and putting it in a smaller group, because I think the number of people that are capable of going out and securing and maintaining employment is far smaller than the population that requires more community access type stuff. Where you're going to get your pre-employment skills. And so if you beef up the quality of the community access programs, you potentially end up with a population that has more employable skills. And as a funding thing, I have a daughter that's about to enter service, she's graduating school, and I know that there will be, as I've been told, there will be money for her to, for the support that she needs at a cognitive functioning level of 12 to 18 months. However, there's going to be no program that's going to accept her, so that decreases her social inclusion, because then she's following me around all day.
Excellent question. Transition from family supports for children with disabilities into the adult programs, that's a key focus. We know that lots of people who have been supported by the family support for children with disability aren't eligible for PDD. And they have historically been, not receiving the supports they need. PDD, if you get into PDD, then you get a lot of support.
She does have a contract, but she needs to get into a program, but the program already is refusing her before these cuts came, and so now we've got $42 million less. Who's opening their doors?
I think what will happen, if she hasn't already gone through that process and around transitioning, and Dr. Hilliard can speak to it, is really around kind of what's the long-term plan. What is the focus? If it is community access based on the support needs, then that's what makes sense. People will, look at in terms of what's the right goal. When the minister is saying that, there is still money within community access and employment, absolutely is. Is there less? Absolutely there is. So it's now really looking at how do you make sure that as we're going forward at an individual level, that you have a plan in place that's going to tie to the support needs and the goals of the person. That is the critical discussion.
I'm just going to say, we do, for those of you with your hands up, and I see a number of hands that desperately want to ask questions, we have 2 people going around with mics. Maybe, Brian, can you stand up as well, and Denise, just so that people know whose eye to catch to be able to get on the list for asking your questions. And to also, please try to keep your questions as tight as possible, because there's a whole bunch of other people who want to ask questions too, and we only have about 19 minutes left.
My name is Jan Mason, and I have 3 boys who receive PDD services at this time. My question is that the government has chosen to increase FSCD funding for staffing because they recognize more children are coming into the system and the families need support. Do you guys think that our kids are going to die by the time they hit 18?
Our budget, we believe, supports the numbers that we're going to have for the coming year. We build a budget on a 1-year basis. We know there are more children coming into FSCD. That's because, quite frankly, we have a number of people immigrating to our province. We know what the intake levels are going to be. And our budgets will track those people through time. I think this question, and actually the question over here, touched on an interesting thing that I need to share with you about transition here. This year we want to move to supports that provide for better inclusion in our communities. And that's a vision, that's a thing that's been talked about for a long time. We're doing it. Maybe it's too aggressive. We'll get through that. We'll work together on an appropriate schedule there. But longer term, there's lots more to come. Where I see this going, I want to get rid of that line at 18 years old, where magically you become some different kind of a human being. We're going to provide supports on a continuum through a person's life based on their needs, as those needs change through their lives. Forget about 18 and forget about diagnosis. It supports based on need and based on life situation and natural supports and all those things to allow people to be the most that they can be, to belong. And that's where we're going longer term. That'll be in future years' budgets.
Mr. Oberle, my name is Alan Ryan. I'm the father of a 19-year-old with severe autism. I appreciate the goal of outcome as employment, but have you thought that an immediate outcome of changes in funding will often be effectively confinement and exclusion? With that in mind, do you have provisions in place for at least 90-day notice of changes in an individual's programming and provisions for appeal, because catastrophic consequences could follow with unplanned changes?
Absolutely. Absolutely. Thank you for the question. A very specific question, and I don't know the circumstances, yours or your son's. I'm going to ask Dr. Hilliard to comment on the local Calgary situation.
Well, sir, I don't know your specific circumstance. However, the answer is yes. If there's going to be any change of any significance, clearly we're going to be talking to people about that well in advance, and there will be transition, and the point of being able to appeal certain decisions still remains with you. Our attempt would want to make a seamless transition into something which is appropriate and be well ahead of that curve. So that's over the course of the next 2 months, a lot of work is going to be around that. But clearly, there will be opportunities for you to voice concerns and appeal as required.
Hello, my name is Cindy Maury. And I attend a rehab that has a whole bunch of different people with different disabilities. As you see in the room, there's a few people here. And there is one person with that specific disability. But if you place 4 more people on that one client, how do you expect one person to care for all 5 people that you plan on putting in? As myself, I have seizures. Now, if I have a seizure and you have one person running out of the building because one person is caring for them, how do you expect that caregiver to do the job and care for the person having a seizure or having a fit or whatever? How would that work with 5 other clients on that one worker?
When we're looking at circumstances like you described, we want everyone to be safe. We want everyone to be comfortable and have the supports aligned to their needs. So simply we'd review that to make sure that everyone was safe in that environment, and we wouldn't create a situation that you described. We would work to ensure that there was safe and appropriate supports around that group.
My name is Karma Mahoney. I have a daughter who is quite sick, complex needs, mental health and PDD, developmentally age 7. And you guys talk about inclusion, meeting the needs of these folks. And what I'd like to know is how you sleep at night, because my daughter, multiple times over the last few years, she's been on PDD services for 6 years. She recently was put into a temporary residence only because of my involvement with the media and an individual who cared enough to pull some strings and assist. But there's still no guarantees. And she has minimal day support, 5 hours a week. And that's taken, like I said, 6 years to get to. So I'd like to know how it is that you plan to keep people safe and not use the plausible deniability clause that it's okay to transition to places like the drop-in center. Because that
Thank you for that question, and obviously a very personal situation. I can underline again, I don't know the specifics of your situation, but I can underline again that people who need supports will still get them. The transition that we're trying to achieve here, the overall vision of what we're trying to achieve, I think is supported by pretty much everybody I've talked to. If we've chosen too aggressive of a path, if our funding won't address the path that we need to go on, then we'll have to revisit that. But I recognize that we won't be successful in achieving that overall vision if we're not here today listening and in the future listening. If you don't have an opportunity to sit down and discuss your individual situation, you will have that opportunity. We'll be back. We'll continue to talk in forums this large and smaller ones and right down to the individual level. You will have an opportunity in very great detail to discuss your particular circumstance and address how we're going to together move forward to provide those supports.
So I'm just wondering, you keep saying that you don't know everybody's specific situation, yet you're going to take this intensity scale and do community support based on the outcome. You take every aspect of people's lives and then give an average to it, and that's the support people are going to get. Who are you to say how much support somebody deserves? And people here are talking, they don't even get the support they need, yet you're going to take extra support away, but oh, it's going to be okay.
There is a variety of support needs across the population in this province, in these regions, and we've never really had a good understanding of what those needs are. Hang on. The supports intensity scale begins to give us an understanding of a common assessment and a base to appreciate what the needs are across the province. There are differences in various communities, and there's differences in terms of being able to make plans. So this information helps us on an individual planning level, but it also helps us at an aggregate level within the region and the province. It allows us to be able to talk to politicians. It allows us for our minister to be able to talk to the other ministers about the significant profile of support needs that are required across this province. So it's useful at multiple levels. It is one piece of information at an individual level for purposes of planning. It is not the only information that's used for planning. but it helps us on a number of levels and information that we've never had before to be able to influence decision makers about the significant needs that this population requires to be included in the community.
Doesn't work. I'm the legal guardian of 2 mentally challenged sisters. I've been their guardian for over 30 years. So I've dealt with PDD for over 30 years. I've gone through appeals and everything. Now I would like to know why you are taking money away from the most vulnerable people in our society. The money that they are spending from our tax money on themselves and their families. Go after that money.
This is indeed a challenging budget year, and I'm not going to deny that. And our department got an increase, albeit a small one, in a very challenging budget year when many other departments took very significant cuts. In addition to that very small increase, we're cutting 10% in administration costs across the board. That includes our department, that includes the PDD organization. There were no salary increases in the public sector, there were wage freezes. We are doing absolutely everything we can. Again, I have to underline that people that need supports will get the supports, and we will find a way to do that.
Hi, my name is David Johnstone, and I speak for every client here and every special needs here. You are so mean to us. We need this money. We work in this society and live in this society as we are part of, we are human, and so we need this money. So that's what I'm saying.
Well, thank you and all of you for your heartfelt comments. What you need is support, not money. You need support. And I will find a way to provide that. I will find a way to provide that to ensure that people who need supports get supports. The money is my consideration in taking back and building a budget. Actually, the SIS comment earlier, that will help me build budgets going forward. We are concerned about supports that people need, and we will provide them.
Take it out of your pocket.
And I did take a wage decrease, by the way.
I just want to jump in here for a second. Ministers come to listen, and this is important that we have this dialogue. This is not the only dialogue, and it's important that we exchange in a respectful way, because that's where we're going to get to. I think you've heard a lot of openness here. I must also say that PDD in an Alberta context compared to across the country and international is a very well-funded program. There is many people in Alberta with disabilities who do not have these kind of opportunities. We're trying to build an Alberta community that includes all people of disabilities, not just in terms of based on a certain diagnosis. That's what you heard today. Do we have some challenges with the fiscal situation? Absolutely. But we need to work together, and that's what this is about, is around working together. So will there be some shifting? Absolutely. But if we take an antagonistic approach, we won't get there. And that's why we're here, and that's why we will continue to come back here.
Dear Chair, dear Minister, I have respect for you. I know you're doing your best. And all of us people here should be doggone thankful that we have a minister who gives a rip about us. Thank you, sir.
My question is for somebody with higher function, like higher functioning, need has day support. Now, is that going to get cut? Because I only have 2 days a week with my day support worker. And with all these cuts, how is it going to affect us?
Thank you for the question. Clearly, we're going to be looking at each situation individually. The intention, as the Minister has said, within all of the regions, we'll be looking at matching the appropriate needs to be connected to the community for you individually. We want to create social networks for you, ensure that the people are not being vulnerable and they are connected. So we'll review each of those on an individual basis to make sure we have those outcomes for you.
I'm going to take advantage of my position here to actually ask a question, because there's something that's come up a lot in this discussion that I think hasn't been addressed, which is the definition of the word needs. And I think we have some very different ideas of what that means, and that what we're seeing is the definition of needs from the government perspective seems to be decreasing in what they define as a need for people in programming, where we have growing need in the community, but not a growing support from the government programs. But we also have a growing need from the oil companies for profits, and that need is being recognized. So it's rather troubling that, as Ms. Redford said, we have a quote here, thanks to the Revolutionary Knitting Circle on a little blanket on the table there from Ms. Rutherford, that it's important to protect our most vulnerable Albertans. But that seems to be of secondary importance in the needs scale that the government is exhibiting. So I'm wondering how we can come to a mutual understanding of what need really is, and that's my question to the Minister.
Thank you, Grant, for that question. And on a specific definition of need and how we arrive at that, I'm going to ask Brenda Lee to comment. But I can't let your umbrella comment there go unanswered. We have a very healthy economy in Alberta, and we're quite proud of that. And that's what funds all of our programs: healthcare, education, supports for persons with disabilities. That's funded by a very robust economy. And we don't want to lose that. So yeah, we're going to work very closely with the energy industry, all our industries, to ensure that we continue that going forward. Those are the people that will employ all of us. Those are the people that generate the wealth in this province that allows us to extend care to people who need it in our province. I'm going to ask Brenda Lee to comment specifically on a definition of need.
I would say our definition of need is really based on people's daily living support. So that's how it's defined in terms of the support intensity scale, in terms of what does it take in order for a person to be able to function independently or with support. That's their definition of need. One of the things that we've been talking about from a disability perspective across the lifespan is needs are one part of the equation. But what about strengths? What about the strengths that a person brings to it? And that is, I think, as we focus on diagnosis, which is kind of, what is a person, having to live with, we need to move beyond, just needs. Needs are critically important to look at what is the strengths that a person brings to the situation. And that, I think, is the next stage of our discussion. Because people with disabilities have a lot of strengths. They enrich our lives and the community. So how do we move to that too?
And I'm afraid on that note, our time with the Minister has closed. We're at 10:30, unless we can convince him to stay for a few more minutes, which...
I'm deeply sorry. I do have to run. I have another engagement here right away. Just let me say that this is not in any way the end of our conversation. I'll be back, and I'm quite happy to meet with groups this large. We will be having regional, more focused, smaller group meetings going forward. We're always available to meet with individuals. I'm going to be a very accessible minister. I'm going to ensure my staff are accessible to you. This is about you, about supports going forward. We won't be successful unless we have the ability to talk and to understand each other. So we will be back. We will be back. Thank you very much for your time today and the excellent questions that we've had. Thank you.